I feel like when, especially those of us who aren't healthcare professionals, those of us who aren't doctors, talk about the vaccine and the variants, a lot of what we talk about is whether or not the variant strains of the virus are susceptible to the vaccine or whether or not they're going to defeat the vaccine in some way. But it sounds like we should also be thinking about it the other way, too, that we need to vaccinate as many people as fast as possible, as suddenly as possible. We need a mass vaccination rate, in part to prevent the emergence and circulation of the variants. Is that fair?
You are exactly right. So we know that RNA viruses mutate, and they mutate the more virus you have. So the more virus that is out there and replicating in an individual person and in all of the society, the more likely that variants are going to emerge, which is why we really want to keep the case numbers down. We really want to keep the amount of virus down. That will keep the amount of mutations down. And as we do that, those mutations won't emerge that put the risk of efficacy of our vaccines.
So that makes clear that what we're in is a race, that it's the virus, and specifically the mutating virus, that we are racing against with our vaccination efforts. That makes me happy that we are speeding up our vaccination efforts, that we hit 2 million and then 2.9 million, and hoping we're still going to increase that pace. Dr. Ashish Jha from Brown University said last hour on MSNBC that he's hoping that we could get up to 4 million doses a day. How fast do we need to go in our side of the race in order to outpace the mutating virus? Dr. Michael Osterholm has a terrifying interview out with New York Magazine right now in which he says that we're losing the race. He's predicting another big surge over the next few months, saying that the variants are transmitting fast enough that our pace of vaccination right now isn't enough to stave off another big surge. How fast do we need to be going? What are you aiming at in terms of how fast our vaccination efforts need to get?
I think we need to understand that March and April are critical periods here. We have variants in this country. Those variants are increasingly transmissible. We know that they're more transmissible than the wild type virus. We also have more and more vaccine coming. And this is really why we have said for the next couple of months, while we are scaling up vaccination as much as we can, as fast as we can, as much vaccine as we can, please wear your mask, continue with the mitigation strategies, and give us a fighting chance of making sure that we can get vaccine into people as soon as possible. And as individuals, when that vaccine is available to you, roll up your sleeve and get it so that we can really be sure that we are winning this race.
Thank you.
Thank you.
Thank you.
Thank you very much.
Thank all of you out there. Thank you as always.
Thanks to at home.
Thanks for watching. Thank you so much for letting us into your homes during these extraordinary times.